Hello, friends and neighbors and countrymen and family and anybody else who wants to be addressed. Steve here with Pain Lab, and I am once again headed home for the day and wanted to take a moment to utilize my time efficiently and get a few thoughts over to you all about the idea of preparation for surgery and recovery time post-surgery. So a lot of times people will come in or use the Firefly system, light therapy, and Neuro20 because they are hoping to avoid a certain procedure or some kind of surgery that may be recommended based on their condition. And in many cases, an individual may find real success and be able to put off or cancel a particular surgery. I don't have one specific type in mind, but I'll use an example from a real life situation where an individual had severe tennis elbow so bad that they had scheduled surgery. They used the Neuro20 suit for about 6 weeks and then were able to cancel the surgery. That's a great story. Doesn't always happen that way, but even in a case where the individual may not have seen as much progress as he did, in other words, didn't necessarily think that it was wise to cancel the surgery, he was still preparing his body for the best possible outcome. Now, we use Firefly infrared light as well as red and blue light, and that I generally will try to use before doing a Neuro20 because I want to open up the blood vessels. I want to get the neurological system, the nervous system, activated with that light, and then come in secondarily with Neuro20. And I think we get better results by doing that. But in the case of a surgery, you're preparing that area. All right, let's say it's a knee or an elbow or whatever it is, knee replacement, hip replacement. You're preparing that area and getting the surrounding tissue healthy, strong, and then setting yourself up for recovery times that will definitely be shorter than average. I know I've mentioned a couple of times in the past about scenarios where individuals did this and after a successful surgery saw recovery times cut in half for certain types of surgeries. Now, I'm not trying to be specific to every type of surgery out there, but in scenarios where individuals had to have, knee surgery, hip surgery, this type of thing, they're going in better physically prepared pre-surgery, and then when it's over with and they've gotten past that initial phase of recovery, they can even begin to use these tools again to whatever degree practitioners see fit. But we even had a case where an individual prepped for surgery with a number of sessions with Neuro20, and then because of the schedule they had, they weren't able to come back in after the surgery, but they still recovered and healed faster than average. And so again, it's just, it's great to try to avoid, if possible, by repairing a situation, fixing the scenario with these very successful stimulation therapies. But even if that isn't the outcome, you're doing yourself a tremendous favor by being as prepared physically as possible, and then really cutting down on your recovery time afterwards. So I wanted to share that thought, just kind of get that out there. if you or someone you know is heading in the direction of a potential surgical procedure and you would like to take advantage of these types of stimulation therapies to best prepare for that situation you're headed into, give us a call, send us an email, stop by, sit down and talk with Dr. Anderson and myself about the circumstances. You can always reach us through our website, which is painlabkc.com. My email address is steve@painlabkc.com. And obviously you might look at a couple of other videos that we're also posting here. We don't have tons of stuff yet, but we're working on it. And feel free to go to that website again, painlabkc.com, and check out the summary posts that we put there in the form of a blog. Some of that stuff could be very helpful. And that'll do it for now. I appreciate you watching, and we'll see you again. Bye.